If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 15th season, and as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we are here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, you can call our live phone line at 718-499-6101, and second, you can email your questions to askthedoctor@netny.net, and we'll bring them into discussion. And only for this season is the Net Viewer Survey. If you haven't done so, please take the time to participate as you wait for your turn to go on the air. Now, this survey is here because we'd like to give you a chance to officially and anonymously sound off your opinions about Ask the Doctor and net programming in general. Now, for those who could not get through and are not on our mailing list, please write to Net at 1712 10th Avenue, Brooklyn, New York, 11215, and ask for the survey to be mailed to you. Of course, you can always participate online. But now, if you read this week's tablet, I think it's on page 43, the survey is written, is there for you to fill out, and you can cut it out and mail it in. They tell you the address. So go to the tablet. It's a great paper, and it's got the survey, and it's critical that you send it in because they're looking at this like it's a Nielsen rating. So if we don't get the ratings, we don't come back next year. So if you want to see Ask the Doctor for 16th season, or any of your favorite shows, you want to start to fill this out. So if you don't have the computer, go to the Net or the tablet, and you can get that. Now, also, you know, the Net is one of these nonprofit organizations. They all have trouble. You watch channel 21 and 13, they have fund drives, fundraisers. So for the Net, if you send in $60, you're not paying for the shirt $60, but if you send in $60, we're going to give you this official Ask the Doctor shirt. Limited edition. There's only about 20 of them in history. They're selling very fast. We have our people in Chinatown. They're going crazy. So, and accept no imitation. I keep telling you this. You know, you get one that the colors run. This is the best quality polyester you're going to get. Okay? You'll never get better. So if you want this shirt, $60 to the Net. Very small cost for all the shows you get on the Net. And we're going to send you this T-shirt as a thank you from the station. Now, you can call us tonight to make your pledge and reserve your shirt. You want to get that reservation, and you don't want to be shut out. Now, remember, you must say Ask the Doctor when you send in the payment. As always, thank you. Now, for this episode, we have a great show. I mean, we got you covered from head to toe. First, Dr. Robert Goldberger, private practice dentistry and endodontics. Tricky thing, endodontics. We're going to find out what that is. And I know anybody who's had it knows what it is. It's not an inexpensive thing. Right?
It's moderate.
Moderate, but what price to have good teeth, right?
It's worth it.
Now, for the mind, and we constantly get questions about psychiatric people to come in, doctors who are psychiatrists, and we've done it, we listen to you. Dr. Sandra Koifman, Director of Psychiatric Consultation Liaison Service at New York Methodist Hospital. Fancy terms, we'll get into that too. Dr. Michael Abbott, he's got internal medicine, pulmonary medicine, geriatric medicine, and he's an attending in all three at the New York Methodist Hospital. Welcome. And this is your third visit with us, I believe.
My third visit, yes.
And Dr. Koifman and Dr. Goldberger, first visit.
First time.
So we're having a little fun with you, the initiation sort of thing. But in the news, let's get right to the news. Busy week. Coca-Cola can kill? Well, they did a study of females who were middle-aged women, large number, like 50,000, and they found that if you drink 2 of these Cokes or any sugary drink, doesn't have to be Coca-Cola, it could be Sprite, it could be coffee that's loaded with sugar. So anything loaded with sugar in women predispose them to have diabetes, to have increased blood pressure, and also to have abnormal fats floating in their bloodstream, which led to about 23% increase in heart attacks and about a 13% increase in strokes. So it's kind of scary because you think of a few Cokes. And the interesting thing was these women didn't gain weight, all of them. They were putting the fat on in the internal organs where you couldn't really see it, this bad fat that we've talked about in the past. So you don't always see this weight gain, even though drinking a can or 2 of soda a day can add a few pounds on a year. This study didn't find that. This study found that these, irrespective of the weight, that these women had the problem. So something to think about. You can go to Diet Coke, Problems with that too, but it seems to be safer. Now, the second bit of news, for women who have had breast cancer, their daughters are at increased risk if they drink, and as much as 1 drink a day. Now, they couldn't put a label on how much the risk was, but it was definitely an increased risk. Study found increased risk in benign breast disease, but some of these benign breast diseases had a predisposition to turn malignant. So if your mother had it or your aunt had it, you may want to limit your alcohol. Again, it's not an official recommendation yet, but something to keep in the back of your head. Now, cholesterol testing. We used to think we didn't have to start testing kids till they're like 18, 19, 20. New studies are showing we're missing maybe 50% of kids with abnormal cholesterol by waiting so long. So the new recommendation is at age 9 to start your cholesterol checks at the pediatrician visit, and then again at age somewhere between 17 and 23. Hopefully to pick up the abnormality before it does the damage to the blood vessels, because these start when you're young and begin to erode and cause problems that lead to heart attacks and strokes and other problems down the road. Now, Dr. Goldberger's field, teeth cleaning can do more than fresh breath. It seems that if you have at least 1 or 2 good scalings by a professional hygienist a year, that you're going to significantly decrease your risk of heart attacks. Has to do something with chronic inflammation and some of the bacteria that get into the bloodstream and land in the heart and cause this inflammation. So it's very important to keep this appointment, and the suggestion was twice a year. And they compared the difference to people who had once a year or no times a year, and it was a significant difference in the number of heart attacks later on in life. So it's interesting. Monsignor Bennett is here as always. He has not missed one show. Monsignor, thanks for coming. And we actually go out to brunch once a month, the River Cafe, and we have a brunch coming up this Sunday. So thanks, Monsignor. We'll talk later. I want to give a shout out to 2 loyal listeners, Alan and Louise Goldberger, who have been watching this show for quite some time and have given us the honor of having their son on the show. But so you want to give a shout out to that?
Hi, Mom and Dad.
Good to have you on board. And we can't leave out Dr. Simon Kaufman, who is on the staff also in New York Methodist Hospital.
That's right.
And a relative of yours.
Happens to be my
father,
dad.
So it's always great to have loyal parents and loyal guests, so thanks a lot. Now the all-important quiz, so get your pencils ready here. I'm going to read this slowly. America loves desserts, no doubt about it. Thanksgiving's coming up. A lot of our people out there are preparing for desserts. What are you going to have? You know, who knows, pumpkin pie, whatever. What are the top 5 desserts in favorite order in America? So the most popular, the next. So to give a little hint, I'm going to tell you it's ice cream is number 1, because I figure everybody's going to guess ice cream. Can you name the other 4 desserts that make up the top 5? So ice cream is number 1. Don't give me that one. But tell me the next 4 that make up the top 5. Now the number to call is 718-499-6101, and you're going to win that plaque. You don't know, we give a beautifully handmade plaque from Japan. It's amazing, imported, especially for this. People love it. There's only about 23 out there in existence, so you'll see it when. So tonight's topics are dentistry, psychiatry, internal medicine, geriatrics. Email us your questions to askthedoctor@netny.net, and please take that survey. Don't forget, go to the tablet, get the survey out. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are dentistry, psychiatry, internal medicine, and geriatric medicine. We're going to meet the doctors, and in a while I'm going to tell you one other way that you can get this t-shirt by supporting a good cause. So we'll talk about that a little bit later in the show. We have Dr. Goldberger here. Endodontics, what is that?
That's root canal.
Oh boy. Is that painful?
Not at all. Not at all.
For full disclosure, I have to say I went to Dr. Goldberger, felt no pain. Amazing. I think it was done, within about 6 hours? No, it's about 30 minutes, I felt like.
Maybe an hour.
And you were teaching, you have students in the...
Yes, I do. I direct the postgraduate endodontic residency at Lutheran Medical Center.
Which is great. And what kind of, how do people know when it's time for a root canal?
Sometimes it's pain. Sometimes it's swelling, infection. It's not always one particular symptom or another. It could be a dying pulp tissue. We call it pulp tissue. It's fibrous connective tissue. Patients call it the nerve.
Okay. Oh, so that's the nerve you take
so
out.
the nerve that, right, it's pulp tissue. It's, like I say, it's connective tissue. When that becomes inflamed, there's a lot of pain. But sometimes it necroses very quietly, and there's no pain. But then ultimately you end up with an infection and a swelling.
You lose the tooth, maybe?
No, do root canal and save the tooth.
You can save it.
We can always, well, not always, but most of the time we can save it.
Fantastic. And tell us, now I know you went to Midwood High School.
Yes, I did.
Which amazing. I went to Midwood High School. Now you have your son that went there.
My son Jared is also a graduate of Midwood High School.
What is he doing now?
Jared is a tax attorney in the city.
Oh boy, I could use that. Yeah. Just got a little letter from the IRS, so I'll talk to you after the show. Yeah.
And he and his wife Danielle are pregnant with their first child.
Wow,
so
fantastic. And he's going to be born in Brooklyn?
Manhattan.
Okay, it's
A little better than us. A little better than us, yes.
That's great. So we really welcome you. I want to hear a little bit later about these implants too, implants versus root canal. I know we've gotten a lot of questions in the past. I didn't have a dentist here, and now we have you here. So
Great.
thank you.
Happy to be here.
Great. Dr. Koifman, and it's a pleasure to have you. I can't tell you how many people have been calling up, particularly with the holidays, Thanksgiving coming on, so much work that are just feeling down, a little blue. And how do you tell the difference between feeling a little blue and actually having a serious depression?
Well, one of the things to remember is that holidays don't change your life. Holidays are there to enjoy your life, but if you had problems before, chances are you may have a problem now. So you should continue doing what you're doing to keep yourself well. And with holidays, keep that in mind, that the goal is still to continue doing your normal routine, enjoying things that you enjoy. But if you're not doing well, it's always important to call people who are your best supports. And it may be a doctor, it may be a friend, it may be a family member, but don't forget about your networks. And essentially, if you're doing significantly differently from how you normally are, that may be time to recruit the help.
And now another family matter, your wife is also at the hospital?
Yes, she's a cardiologist.
What's her name?
Dr. Julia Katz.
Julia Katz. You took her name or she took yours?
We didn't.
You meet the pants.
Either way.
Okay. No,
it's a brand.
No, it's a pleasure. It's a pleasure to have you here. And we were talking about high schools. Dr. Abbott went to Madison High School, and then you said number 6. It seemed,
Yeah,
but
I
it's
know.
not fair. We have. But then you went to
NYU for undergrad.
And then first.
I was actually trained at Downstate in Brooklyn.
Excellent program.
Yeah.
So we're going to get a lot of questions for Dr. Koifman. Any of you, you're feeling a little depressed, or your child has some problems, and you were just elected president of an organization. What was that?
Right. Disaster Psychiatry Outreach. We do a lot of work in disaster areas, and around this time we always ask for support. So it's a great chance to plug.
You're looking for money?
this.
Well, you
We're
want to
always
take the
looking
shirt?
for money. But we help
Okay.
people who otherwise would not get the help in disaster areas, and it's an important thing to keep doing.
We're going to get right back to you. Now, Dr. Abbott, it's a great third time we've had you here, and I know you big hit the other times. What's been going on in your life?
Well, my son Stephen got married.
Oh, congratulations.
Now I have a daughter as well. Her name is Nicoletta. And they live in Washington, D.C., along with my younger son, Richard. And I'm very proud of all three of them.
Excellent. And you grew up in Brooklyn area. Mill
Yes,
Basin, was
Mill
that?
Basin. Mill
Excellent.
Basin.
A lot of, it's kept up beautiful neighborhood.
Beautiful
Great place to
neighborhood.
live. Where do you like to eat in Mill Basin?
Mill Basin Deli.
And I thought you were going to say that. That's the one with the artwork?
That's the one with the artwork, yes.
What's that guy's name? The artist?
Picasso? No.
No, but the artwork is really in the pastrami sandwich, right? That's the artwork.
Actually, the tongue sandwich.
The tongue sandwich, you have different preferences.
Absolutely.
So we've met the crew, and you can see that I didn't lie to you. We have a great show. Now we're going to see who's our first caller of the night. Hello, Millie?
Hello?
Hi, who is
Yes.
this?
Yes.
Hi, who is this, please?
Millie Deal,
Millie, how are you? Where are you calling us from?
Canarsie, Brooklyn.
Oh, great. My kids went to school in Canarsie, PS 276.
And I went to 242. Your father was superintendent
Yeah.
at school.
He was superintendent and chancellor
Harvey
of the school.
Garner.
Yeah.
Right.
Thank you.
Yes. I went to get an MRI. I had pain in my leg,
Okay.
and they found that I have a Baker's cyst in back of my knee.
Yes.
And what could I do for that?
You want to take that, Mike?
Sure. A Baker's cyst is just part of having osteoarthritis. So if you have a Baker's cyst, the best way to take care of it these days is to take some non-steroidal anti-inflammatory if you're able to do it. But Millie, be careful with that. Make sure you take it after food. A non-steroidal anti-inflammatory is like Motrin or Aleve. And please make sure you take it after food. When you get up in the morning, I would suggest you put warm compresses on it. And before you go to bed, put cold compresses on it.
Thanks a lot, Millie. I hope you have a great Thanksgiving.
Okay, but there's nothing else I could do, right?
Well, I mean, of course there are, if the pain is really bad and you see an orthopedist, they can give you some injections for it to help the pain. And eventually, if it gets worse, you may need a knee replacement.
Thanks, Millie. Take care. Now, I got an email from Lori who wants to know how long it would take to have a mouth guard made for her 9-year-old who plays hockey. What do you think about mouth guards for hockey players?
I think that's great. I think all the children playing sports today should be wearing mouth guards, whether it's hockey, baseball, soccer.
Do they have to go to the dentist to have that made?
You don't really, and especially a 9-year-old who has a mixed dentition, it's in transition. So if you go to a dentist and they take impressions and send it out to a lab, it becomes expensive, and then it's not going to fit after a few months because the dentition is changing. You can go to a sporting goods store like Modell's or any of the others, and they have these where you just boil them in water and you soften them, just follow the directions and
Beautiful.
be careful about it, and form them to the mouth, and they're very important and very underutilized.
Quick question. A 6-year-old kid playing hockey gets a tooth knocked out. Do you put that tooth back in?
If it's a permanent tooth, yes. If it's a primary tooth, no.
No, so...
6-year-olds, it's
on the border.
Yeah, most of them are...
Just call your dentist if that happens. What do we got, Maria? Maria. Hi, Maria.
Yes,
Hi, where are you calling us from, Maria?
Midwood.
Midwood area. Did you call last week, right?
No,
No, someone's using your name, I think. I don't know. We had another Maria.
there's a million Marias.
Oh, okay. Where do you like to eat in Midwood?
The same place that you were talking about, the deli.
Oh, you like the Mill Basin Deli?
Yeah.
Sort of on the border of Midwood.
Yes.
Dr.
yes.
Abbott was telling me
I'm
about
on the border.
Yeah.
I'm in near Marine Park.
Yeah, what is that noodle place? Dr. Abbott was telling me about a noodle.
Oh, across the street from my office on 18th Avenue and 72nd Street, there's a pull noodle place where they make their own noodles and stretch them and make noodle soup.
Really?
So if you
Pretty
go
good.
in there, yeah, mention you heard to ask the doctor, okay?
Okay.
What can we do for you?
Well, first of all, I'd like to. I have a rash, and my doctors, they don't know where it's coming from. Like big, round, red marks on my arm.
Okay. How long is it there?
It came, it went away, 2 months at
Okay.
least.
You know, rashes can be tricky. Let's see what Dr. Abbott thinks, then I'll weigh in on it too.
Yeah, Steve's right. Rashes can be tricky.
And itchy.
Yeah, I mean, it could be, some type of psoriatic or seborrhea. It could also be something that's dangerous as well.
That's what I'm thinking.
And if it doesn't go away, you may want to see a dermatologist. They may even want to biopsy it if the creams don't help.
I like
Right.
that. I like that. After it doesn't go away a number of times, comes
It
back,
does go away, it comes back.
let's get a biopsy of that. Yeah. We can help you out with a referral if you don't know a dermatologist. If you call us
No, I
after.
don't know a dermatologist.
They'll take your name down and we'll talk to you after the show.
The doctor that's sitting next to you, he's from the same hospital my doctor's from.
Dr. Goldberger?
Yes.
Which
he's
hospital is that?
Lutheran.
Oh, you're a Lutheran as well.
Yes.
And
Well,
what-
I have a doctor that comes to the house. They have a house call.
Okay, that's good.
Yeah, and I really do need
Maria, we'll get you the referral, and thanks for calling. Okay.
What about the brain tease?
Oh, you ready for the quiz? Okay, wait. I got wrapped up in the medical issue. Wait a second. Let me shift gears. Okay. The question is, what are the number one dessert in America is ice cream. What are the other four that make out the top five? So what do you say?
Pies. Do you want to know about what kind of pies?
I need more specific. Yes.
Coconut custard.
Okay, coconut.
Pumpkin, apple.
Pumpkin, apple. You got one more.
Wait. One more. Oh my goodness. Cheesecake?
Okay. Did she get all four of those? Oh, I'm sorry. You had two correct. I'll tell which two a little later on. I don't want to give that part away. But you're on your way. You were well on your way. I'll give you a hint.
Pie?
The pumpkin was not a good answer, no.
Oh, good.
All right, take care. Bye. Hi, Kara.
Hi, how are you?
Where are you calling us from?
Midwood.
Midwood, too. A lot of big crowd out there.
I
Midwood.
know.
You ever go to the Midwood movie theater? On Avenue J? Yeah, it used to be there.
Oh, is that on Coney Island Avenue?
No, that was the Kent. The Kent is still there, I think, actually.
Oh, yeah. No, I haven't been here but maybe 4 years, so I don't know.
What do you like to eat in Midwood?
Well, I usually go for Chinese at the New China Star on Flatbush.
Yes, you like Dr. Abbott knows these places well. He's shaking his head, yes.
It was my mother's favorite restaurant.
For those who remember Avenue J, there was Joy Fong. I don't remember
Yes, I do.
Dr. Goldberg.
Yes, I do.
Yeah, that's an old one. So, Carol, what can we do?
A question about dentistry. I'm 68 years old. I've had in my lower quadrant of my mouth a bridge, probably for 7 years, but I've had it replaced 4 times. Every 2 years, I go to the dentist, and they tell me that there's decay underneath it, and it has to be taken out, and the decay addressed, and a new bridge. And my question is it possible that some types of medication that I'm taking, like metformin, simvastatin, and lisinopril, could be causing the decay?
So is that the question?
Yeah.
What's the effect of the medication on it?
Well, the medication don't cause the decay, but they do often cause dry mouth. And if you don't have a good salivary flow, then you're going to get a lot more decay.
Interesting. So, Dr. Abbott?
Does the diabetes
So what do you
have an
suggest? Just
effect
drink
on
more
that?
water?
1 second, Kara. Hang on. I just want to hear.
What?
I'm not sure about diabetes.
You have diabetes
a lot
as well,
of the
Kara.
medications do.
Yeah, type 2.
But we think, that Dr. Goldberger thinks there's definitely a connection there. It's interesting.
So she could use fluoride rinses, which will help.
Okay.
And
Okay,
just
so you think
maintain
it's
good
the dry
maintenance.
mouth caused by the medication?
Yeah, and he's suggesting
Exactly.
some tips to take some fluoride rinse.
Fluoride rinses.
How about toothpaste? Any?
Well, there are most of the toothpaste have fluoride, but there are fluoride rinses that you can get, and they're prescription fluoride rinses.
Okay,
also.
is it common to keep having these bridges replaced every 2 years for decay?
No.
Oh.
Is that the only place that it's decaying?
Well, yeah, where the bridges encompassing 4 teeth that aren't there.
What about the rest of your mouth?
I'm still getting a lot of decay. And I brush 3 times a day, floss.
If it's generalized, then it may be due to the medications and the decreased salivary flow.
Can I ask a question? I don't know what a bridge. I always hear the bridge, the term the bridge. What in layperson's? What does a bridge do?
A bridge spans a gap. So if you lose one tooth, you put a crown on the tooth on one side and a crown on the tooth on the other side, and attached to those 2 crowns is the false tooth. So a bridge.
I see. Voila. Yes, Dr. Koifman.
Actually, a great number of psychiatric medications. None of them are on your list, of course,
Right.
but a great number of psychiatric medications have dry mouth as a very common side effect. So this is something that we frequently comment on, how important it is to upkeep your tooth hygiene appointments and really make sure that you take care of this, because it really impacts your well-being in so many ways.
I see.
Thank you. And we heard about the heart condition before. Well, now we have. I see we have an email coming in from Indiana,
Thank you.
and then we have one from Kansas. Let's see what we have on the line from Kansas. Hi, Kansas. Hello, Kansas. Gets late out there.
Hello?
When they're going to sleep. Yeah, Kansas?
Yes.
Hi, how are you?
Good.
What can we do for you? It's a tough question, I know. It's just-
I wanted to know about the drug Lexapro.
Okay.
That'll be me.
Dr. Koifman's going to tell you about Lexapro.
Okay, I've been on the drug. Well, I've been on the drug for about 10 years, and I wanted to know: can you stay on a drug like this indefinitely? I have a GAD, and I'm being treated by my family doctor. I've never seen a psychiatrist, so you know he just has me on this for all these years. He never suggests that I go off it. He just thinks it's fine to stay on it.
Okay, Kansas, hang on. So
Okay.
tell us GAD, what that is, and then Lexapro, what that is, and then how long she should be on it.
So if we're talking about medication like Lexapro, it's what's called SSRI. These medications are frequently used for major depression or generalized anxiety disorder. The difference there is that if you were being treated for a major depressive episode, then the protocol and something that is the right thing to do is to get the full result from the treatment, stay on the medication for a year after you had full effect, and then taper it off. On the other hand, if you're getting treatment for generalized anxiety disorder, the right approach is to remain on the medication that you're tolerating. And as long as you're not having any side effects, these medications, one of the main reasons why they're so incredibly popular and are the number one as far as the group of medications to be prescribed, they're well tolerated. And most of their side effects are the side effects that go away when you stop the medication. So there's little downside as long as you're feeling well.
Kansas, thanks a lot. I hope that helps, and we'll talk. Have a great holiday. Okay. New York Methodist Hospital is hosting its first ever Thank you, Kansas. Red Stocking Soiree on Wednesday, November 30th from 7 p.m. to 9 p.m. in order to raise funds for the annual Red Stocking campaign. As the oldest holiday fundraising drive in the country, that's interesting, oldest in the country, this program helps New York Methodist provide charity medical care to those who are uninsured. It takes place in the hospital's Carrington Pavilion, featuring a Taste of Brooklyn with cocktails and food tastings. They're going to have several auctions, silent auctions, and this is going to be one of the items to be actioned off. It's so versatile, this shirt. That's why I love it. So anyway, if you want to get them, I think Marty Markowitz is going to be there, and Mario Batali is going to be there. Big time chef, Batali, right? And it's a way that I think we can contribute to our community and to help those who can't help themselves. So those of you who can get there, I'm going to be there if you want to in person. Our doctors are going to be there, I see, and
Plenty.
so we look forward to seeing you. So we had a power pack first quarter. What we're going to do is we're going to take a little break. And before we do that, I want to remind you to take that Net Viewers survey. Get to that tablet, fill it out, and mail it in. Remember, the next time you send in your contribution of $60 or more, what do you get? A T-shirt. So I want to thank you, and tonight's number is 718-499-6101, and the topics are dentistry, psychiatry, internal medicine, geriatric medicine, and once again the quiz. America loves dessert. The top 5 desserts according to a recent survey are, number 1 is ice cream. Can you tell me the other 4? We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
Welcome back to Ask the Doctor, where our topics are dentistry, psychiatry, internal medicine, geriatric medicine, where we have Dr. Robert Goldberger, Dr. Sandra Koifman, and Dr. Mike Abbott. Now let's get to your questions. We have email from Indiana, and Mary Pine in Indiana wants to know if an infant gets a hold of a prescription drug and gets it in his or her mouth, but does not swallow the pill, could it harm them?
I'm going to give that to you. You're the emergency room specialist.
Didn't get in. Most of these pills require absorption, and if you put it in the mouth and you can pretty much pull out a pill that looks the same as the one that went in, then you don't have to worry about that. If it did change configuration, you want to call your doctor. Again, most of these can be handled with a phone call to 1-800-POISONS and or your local emergency department. So that's that. Let's take one more while we have them. My last blood test showed, this is somebody else. I want to thank you for that Indiana call. We're getting up in the world. We get Indiana, Kansas, who knows, next Arkansas. Okay, my last blood test showed total cholesterol of almost 300, an LDL of 170, an HDL of 107. So she's got a very high HDL. For the past 3 months, she's been taking 3,600 milligrams of fish oil pills, as well as adding beans and oatmeal to the diet. She's eating bananas, she's eating all kinds of things. She wants to know, her glucose rose to 123 from 98. Could the foods that she's put on for the fiber that have added sugar make the glucose go up and affect her cholesterol levels? Doctor, that's a complicated question.
Well, you know, I think that first of all, a cholesterol of 300 has to be treated by medication. Diet and alternative care medications are not going to work for this level of cholesterol. Also, I saw that the LDL, the bad cholesterol, was 170, which is also very bad. And while alternative medication, changing your diet, is good to do with diet, exercise, and medication, don't leave out the medication. Please see your physician. Let him or her take care of it.
Thank you. Thanks a lot. Let's go now to Joyce, who's waiting patiently on line 1. Hi, Joyce.
Hi.
Hi, where are you calling us from tonight?
Bed-Stuy in Brooklyn.
Bed-Stuy. We always lament there's not a good restaurant there.
Yes, there isn't.
No. Where do you go when you want to eat?
Downtown to Junior's.
Junior's. You can't go wrong with Junior's.
Yes.
One of the best cheesecakes, right?
Yes, it is.
So you want to venture a guess on our quiz?
No.
No. Okay, that's all right. Do you have a medical question?
Yes, I do.
Okay, what's the question?
I was in the hospital with pneumonia last month.
Mm-hmm.
And, you know, I came out and everything, you know, with antibiotics, whatever. But when I came out, when I was in the hospital, they said that my oxygen level was low. So when I came home, they sent me home with an oxygen, you know, for when I go to sleep, and one when I go in the street. Do I have to always use it, you know, at night?
Oh, we have a pulmonary expert here.
Yeah. What's your name, sweetheart?
Joyce.
Joyce. Joyce, it's very important that you use the oxygen. If your oxygen level gets too low, you could have brain damage, heart damage, and you could also have problems with the blood pressure inside your lungs. It's very important to use the oxygen. Now, the good news is that your lungs may get better as you get healed from the pneumonia. So it's very important to have that checked by your doctor to see if you can get off the oxygen. Now, let me guess, you used to smoke, is that correct?
Never.
Never smoked.
That's why I don't understand. I have sarcoidosis, and I never smoked.
The sarcoidosis will act just like smoking does to rob you of your lung function. You have a lung specialist?
Yes, I go to a pulmonary doctor.
Very good. And all you have to do is ask him to check your oxygen to see if you can get off of it. But most likely, if you have sarcoidosis and you need oxygen, you should stay on it, please.
Thanks a lot for the call, Joyce. We appreciate it.
Okay.
Feel better. Have a
Thank
good
you.
Thanksgiving.
Thank you.
I'm going to start the Goldberger question. I've come to the point where I need a root canal. Would there ever be a time when you would say, you know, instead of a root canal, I'm going to put an implant in there?
There are those times when a tooth can no longer be restored. There's two things. One, you have to do the root canal properly in order to save the tooth, and then it has to be restored properly. And if it can't be restored in a proper fashion, that's the time that you would say, let's sacrifice the tooth and put an implant. Unfortunately, implants are often put in when a tooth still can be saved, just because I don't want to say because it's more lucrative, but it's really because it's an easier procedure. Implants are very easy to restore. They're easy to put in. Everybody makes money. Everybody's happy.
So get a second opinion.
Yes, absolutely get a second opinion.
That's the key. We always talk about second opinions, whether it's in medicine, dentistry, psychiatry, right? It's always a good idea.
And I probably send 2 patients away a week and say, no, we shouldn't save this tooth. You should have an implant.
I love that. Where was your office in downtown Brooklyn?
Yes, I'm on Montague Street.
Were you ever in that
Brooklyn Heights.
Williamsburg Savings?
25 years.
That's a landmark. They used to be the tallest building in Brooklyn, I think. Yeah,
Yes.
Williamsburg.
It was great then.
Great. So let's get to Elizabeth on line 2. Hi, Elizabeth.
Yes,
How are you today? You sound a little glum.
I'm fine.
Oh, good. I don't hear that enthusiasm. Oh, that's good. Where are you calling us from?
I'm calling from Long Island City, Queens.
Oh, that's a tricky area, right?
Yes,
Do you ever eat at the water's edge there?
yes.
Yeah, that's not bad.
No, it's not.
It's been seen better days, but it's not bad.
No, it's not.
Yeah.
And I also attend the St. Rita's Church where Father Monsignor
Oh,
Bennett.
he's out there. You want to say hello to Monsignor?
Hi, Mr. Monsignor Bennett.
He's nodding. He's laughing. So,
My,
what's your question? First of all, do you have an answer to the quiz?
well, the pecan pie,
Pecan pie. Is it pecan pie?
sweet potato pie,
Is it sweet potato pie?
pumpkin pie,
Is it pumpkin pie?
and coconut.
And coconut. Does that answer? Oh, I'm very sorry. Monsignor's cringing. I'm sorry about that, Monsignor. But let me give you a hint. Only one pie on the list. Okay?
Okay.
That's a hint. But anyway, for the others on the line, what can we do for you medically?
Okay, I want to ask Dr. Goldberg.
You know, he's right next to me, to my left.
I would like to know what is a deep cleaning.
Deep cleaning.
Deep cleaning.
Well, I guess that would be when there's a scaling of the root surfaces, when they have deep pockets. Then it's usually with a periodontist, sometimes with a hygienist.
Right.
They go very, very far down on the root surface under the gum, as opposed to just superficially.
Did you have a deep cleaning?
Yes, I did, and because I had irritation in my gums.
Did it help?
I still have an irritation in my gums, and also my teeth are receding in the front.
So she's got irritation?
Periodontal disease is a pretty tough one to beat. Just try to maintain with periodontal disease.
So, yeah, I'm sorry to hear about that.
Are you seeing a periodontist, Elizabeth?
Yes, I was.
No results? No good results with that?
Mm-hmm. So, but my question is, why are my teeth receding?
Yeah. So I just want to just jump in because we're getting another email as we talk, and it's a part of it. What is endodontics again? The audience is...
Endodontics is root canal. That's where you some teeth have one root, some teeth have multiple roots, and each root has a canal that runs down the center of the root, and in that canal is what the patient usually calls the nerve. That's the pulp tissue, the living connective tissue inside that tooth. And so that nerve becomes inflamed or infected, and it has to come out. There's 2 ways to get that pulp tissue out. One is an extraction. Take the whole tooth, the pulp goes with it. Or you save the hard structure. You open up the tooth, you take that little bit of tissue out, you sterilize that canal space, and then refill the canal space. And then we save the hard structure of the tooth, and that's root canal.
Okay.
So, Elizabeth, hope you feel better. I'm sorry you're having these problems.
Okay, thank you.
Okay, take care. So you have Patrick now on line 3. Hi, Patrick.
How you doing, Dr. Garner?
Good to hear from you. How'd you have a good week?
Today was a really bad day, Dr. Garner. I woke up early this morning, and I got very lightheaded, and, just lasted a few seconds, and I went into a panic attack, and I've been sick all day, Doc.
I got Dr. Koifman here. He's going to talk a little bit. I want you to turn your TV off in the background. Patrick's a longtime guest and caller. He's got panic attacks. Tell us about panic attacks and what could be done about it, what causes them.
Well, panic attacks may be a problem on their own or can be a symptom of something else going on. They frequently can be a part of a depressive illness.
But what is it? Like I'm walking out, I feel panicked. Is that an attack or what is it?
Well, a lot of these reactions that we talk about in mental health and in general medicine are quite normal and quite useful. If you are running away from a barreling car, you probably should feel nervous. You should recruit all the resources you've got to make sure you run faster. Problem becomes when you, in fact, aren't running away from anything, and all of a sudden your heart starts beating fast, you start hyperventilating, and you feel panicky, you feel frightened. You can feel as bad as to feel like you're dying, even though you're well aware that there is really nothing going on other than this is something that happens to me.
Patrick, does that sound familiar?
Yes, definitely. But I keep getting this lightheadedness, Doc. What is that from?
It is quite often that when you are in the middle of a panic attack, and that can last from a couple of seconds to a couple of minutes, you not only start having the palpitations, your heart is beating fast, you start hyperventilating, you start breathing fast. When you do that, you can in fact oversaturate your body with oxygen, and at some point you're no longer able to process and absorb it well enough. So you in fact can be lightheaded because you can't process oxygen properly. And it's a very frightening thing. So that's why one of the things that you frequently see in the movies, someone starts breathing in one of those paper bags. It's actually incredibly effective, because what that does, it triggers a mechanism in your brain to stop breathing so fast.
So what happens if I go to Dr. Goldberger? I'm nervous. Do you see this? Do you see panic attacks when they get on for the root canal?
Patients are pretty anxious, but not panic attacks. But they are pretty nervous when they come.
But you have a great way of talking. You talk to people, you make them feel comfortable. I think that's
We try it. It's helpful. It's helpful. And there's always nitrous oxide, and,
that's
and there's always Valium.
Patrick, you're going to take a guess? Let's hear a good guess.
Dr. Garner, one would be ice cream, 2 apple pie.
2 is apple pie.
3 rice pudding.
Rice pudding.
I'm gonna go with Jello and then fruit.
Okay, you got 3 out of the 5. Ice cream is correct, apple pie is correct, and Jello is correct. So for those holding on, you get a chance to, you get Patrick's mistake, but you get the other 2. All right, Patrick?
Thanks, Dr. Garner.
All right, have a good week.
You too, buddy.
Take care. Let's go to Lisa now. Hi, Lisa.
Hi, how are you?
How are you doing? Where are you calling us from?
Sheepshead Bay.
You have a nice, you see, Lisa sounds up, and it makes it's infectious. We're all feeling better now.
Well.
What do you like to eat out in Sheepshead Bay?
Brennan and Carr.
Oh, is that I guess that's Sheepshead Bay. It's on Nostrand Avenue?
Yeah, Nostrand Avenue.
Yeah, they own the place out in the Rockaways somewhere. What's Kennedy's? Kennedy's also they own. So what can we do for you?
I have a question about anxiety disorder.
Okay. So your TV's on in the background, so it's throwing you off with the 7-second delay. Just turn it off quickly, all right?
Okay.
Okay, so she has anxiety disorder. I don't know if we're going to get into what Patrick had.
Okay.
Okay.
So my question is that lately I very often feel very anxious, like I'm going to jump out of my skin almost, or I just want to keep running, and it's a very bad feeling.
How old are you?
Something goes. 50.
50, okay. Dr. Koifman, sound familiar or any?
It sounds familiar, and there are a couple of things that I would want to know about someone who complains of this. And one of the questions is, what other treatments have you tried, and what are the medications that the patient would be on, what medications you would be on? The importance here is that some of the psychiatric medications that are used for anxiety may have a very specific type of anxiety as a side effect. Some of the novel so-called antipsychotic medications have gained use in treatment of anxiety because they're very well tolerated, and they can really help because they work well with SSRIs like Lexapro, Celexa, Zoloft, Prozac. Problem becomes that some of these antipsychotic medications have a side effect called akathisia. It's that feeling of internal restlessness that is very hard to battle and can be extremely disturbing. So you may want to check in with your doctor if you're on a medication like, let's say, Abilify or Zyprexa, and you want to try to be on something else.
Lisa, you know, again, I'm sorry we always have this problem with time constraints, but it's a good idea if you want to call Dr. Koifman tomorrow at the hospital or another, you know, get a referral so you can get this
Right.
question. You know, you got to get it taken care of. It's not a way to live.
I do. I know.
So do you want to take, before we let you go, you want to take a guess? There are only 2 desserts left. We have ice cream, apple pie, and Jell-O. We need 2 others.
Pudding pie.
Okay, pudding pie.
They said fruit?
Fruit. Okay, is it pudding pie or fruit? Oh, dear. Lisa? It's all right.
Okay.
Keep things in perspective. All right, we'll talk to you later.
Okay.
And what we're going to do is we're going to take a short break, come back. We're going to go to the rapid fire where we have so many questions. We're going to get quick answers to the questions, where our topics are dentistry, psychiatry, internal medicine, geriatrics. Don't go away. We'll be right back.
Place your business on TV by becoming a sponsor to one of Net's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on Net.
And welcome back to Ask the Doctor, where our topics are dentistry, psychiatry, internal medicine, and geriatrics, and pulmonary medicine, which Dr. Abbott is a specialist in. And you can take your calls on emphysema, on chronic lung disease, on sleep disorders. Quick word on sleep disorders for us.
Sleep, sleep apnea and sleep disorders. It doesn't have to be that you wake up at night or you can't sleep, you have insomnia. It could just mean that because of a breathing problem, the quality of sleep that you have doesn't let your brain get ready for the next day. And I think that could be a very serious problem for many patients.
Thanks a lot. So we've been taking your questions. Let's go to Victoria first. Hi, Victoria.
Hi, how are you, Dr. Gardner?
Good, thanks. Where are you calling us from?
Yes, I'm calling you from Midwood, Brooklyn.
Again, Midwood. We have a tremendous population out there. Ratings are going through the roof in Midwood. What do you like to eat there?
La Polina, down the block.
La Polina's.
Yeah.
I've heard it. We've had it. What about that pizza place? A nice restaurant attached to it around Flatbush and around N or right around there. You know that place? Salvi's.
Not really familiar.
Salvi's, nice place, right?
Yeah, I usually eat at Nap Pizza on Avenue X.
And do you like the Farrah's or no?
Yeah, they're pretty good there.
Pretty good. That's been there a while. I remember many times hanging out at the Farrah's. Anyway, what can we do for you?
Basically, my question is directed toward Dr. Abbott. I'm 60 years old. I have a slight case of asthma. I don't really get attacks that often, only if I get an allergy attack. But what I really wanted to know was, every time I go to the doctor and I take a pulmonary test, just breathing into the tube with the little ball that goes up and down, I'd like to know, I always fail it, and I'd like to know how I can increase my lung capacity, my breathing capacity.
How could you pass this test?
Just a couple of questions. Do you smoke?
No.
Did you ever smoke?
Maybe for 3 years when I was in my 20s.
How tall are you and how much do you weigh?
I'm 5'9", I'm 300 pounds.
That's the problem with the test. The two problems are that the weight will not let you take a deep enough breath. The best way to pass that test is to lose weight.
So we're going to move on because we're in the rapid fire segment, but I hope that... Thanks a lot, Victoria.
Thank you.
Nice to hear from you. We have Rosemary. Hi, Rosemary.
Oh, hello, doctor. How are you?
Great to hear from you. How is everything?
Oh, good, and I think I have the answer.
Okay, so far we have ice cream,
Right.
apple pie, and Jell-O.
Okay, how about chocolate cake?
Chocolate cake.
And I like cheesecake.
And cheesecake from Junior's. Is that it?
Yes, I like Junior's cheesecake.
Okay, let's see what the judges say.
Is it right?
Oh, Rosemary, you brought pandemonium to the studio here. I can't tell you what's going on.
I'm so happy.
That's
my third one.
I know, I'm speechless. Tell me about, what's your favorite dessert out of those 5?
I like them all. I like cheesecake. I like chocolate. I like apple pie. I like them all. I'm a big dessert eater.
Yeah, that's the best.
Not good, but I do like them all.
You like chocolate cake?
Yes, I do.
Think so.
I like
think
chocolate cake. I like cheesecake. I like apple pie with ice cream.
What about chocolate cake with a little scoop of chocolate ice cream?
Oh, you're driving me crazy.
Okay. I bet it's a rated G. I don't want to go too far.
Right.
Tell me, you have any questions this week?
Well, yes. I want to know about antidepressants.
Okay.
Doesn't it seem
seem like everybody's on antidepressants. Everywhere I talk to people, antidepressants. You go to the doctor, antidepressants. Don't you think, I know we're all stressed out,
Right.
but is there a better way, or do they give them out too freely?
Dr. Koifman's got a minute to answer that.
Well, if you ask me, I'm a big fan of taking people off medications instead of putting them on. The one thing about antidepressants is there is great room for use for them, but it is often that exercise, proper diet, and even talk therapy can do just as much, if not more.
Excellent. So get out there and exercise. Have a great week.
Doctor, we'll see you. Thank you.
Take care. Talk to you next week.
Okay, bye.
Take care. Mayreen.
Hi.
I love the name, Mayreen. I never heard. I heard of Maybelline. I heard of Mavis, but not Mayreen.
Oh, you like the name?
I love the name. Where is it from? The derivation.
My grandmother gave me that name.
Beautiful name. So what can we do for you tonight?
Okay. I have a full upper and lower. And each time I go to the dentist, I ask them, could I get a new dentures? They tell me that I don't have any bones.
Oh, she doesn't have bone material.
In the bottom, so it wouldn't hold. And I don't want, all that drilling and all of that.
So you have full dentures?
Yes,
top
upper and lower.
So on the bottom, if they could possibly put 2 or maybe 4 implants.
I don't want no implants.
And then the full denture would be retained by the implants. It would be the difference between night and day. Because if you don't have enough ridge, you don't have enough bone, that lower full denture just sits and it's just floating in your mouth. It has nothing to hold on to.
But
a couple of
wouldn't
implants
be
would anchor it.
That I could get any more dentures?
I'm sorry?
Could she get more dentures?
No. I mean, she can get as many dentures as she wants. It's not, doesn't have anything to hold on to.
No, Mayreen?
Yeah.
So I think you listen to Dr. Goldberger, what he's saying, and if you need to get a follow-up, you have the numbers there. You could either call me or Doctor and get some more follow-up on that. Okay?
Okay, thank you.
Thank you. Let's go to Connie waiting patiently. Hi, Connie.
Hello.
How are you, Connie? Where are you calling us from?
Calling from Staten Island.
Staten Island. We haven't had too many Staten Island calls tonight. What's your favorite restaurant out there?
Marina Cafe.
Marina Cafe. Dr. Abbott knows everyone. He's shaking his head. He's smiling. So he lives out there. What can we do for you?
Yes, I like to ask a question to the psychiatry about what's post-traumatic stress.
Post-traumatic stress. What is that, Dr. Coy?
Post-traumatic stress disorder, it falls in the group of the anxiety disorders, what we talked about with panic attacks, etc. And the prerequisite, the important part before you can be diagnosed with post-traumatic stress disorder, you have to have been exposed to severe trauma. And sometimes our mind, our body forms a reaction that is not so helpful. And instead of just putting that memory away and coping and moving on, anywhere between 15 to 30% of patients may actually develop a really bad reaction that needs attention. And you may want to talk to a therapist or be on medications that can help to control the anxiety symptoms.
I hope that helps you, and have a great week, okay?
Okay.
Take care. Now, Martini or Martine? Hello?
Hello?
Hi, is that Martine?
Yes, Martine.
Beautiful
Good evening,
name,
doctor.
too. Where are you calling us from?
I'm calling from Starrett City.
Starrett City, right along the Bell Parkway.
Next to Gateway Mall.
What did they build over there, that restaurants and stuff?
Oh, yes, there's some Red Lobster on at the mall.
How is that?
It's good.
Good.
Olive Garden.
Have to go
That's
by
the
there.
best one.
Yeah, I remember when they built Starrett City. There was a lot of houses over there.
Yes.
Is it nice?
It is.
I'm glad. What can we do for you?
Okay, doctor. I went for normally Haitian has story with PPD. Every time you do it, it's positive.
Oh, she's got a positive PPD.
Last year, I went for an X-ray. I have to prove that my lungs are okay. And then it reveals that I have 2 small nodules at the right lungs apex.
Okay, Dr.
And
Abbott.
this year again.
Martine, you're the last caller of the night. Here's the last answer of the night.
Okay. I just want to know what can I do for that, because I didn't pay mine, but again this year they reveal it again.
Yes, Martine.
Yes.
It means that you've been exposed to tuberculosis. Those
Okay.
2 nodules could be some healed tuberculosis. The CDC recommends that if your PPD is a certain size, that you take medication for 6 months. Otherwise, the tuberculosis could break out of those nodules. So you better see your doctor or a lung specialist to take care of it.
Thank you, doctor.
Martine, have a great week.
You too, doctor.
Thanks a
Thank
lot.
you.
Well, I can't believe what happened here. We just ran out of time, and I was loved talking. Any 5-second bit of advice for the patients as far as their teeth?
Well, as far as being an endodontist, if they need root canal, to see their endodontist.
And that's who I go to. That's the best. That's the best advertisement. I'm a chicken, and I go to this man, and you don't feel anything, and you just feel confident that you're in the good hands. So,
thank you.
Thanks, Dr. Koifman. How do we stay happy?
We stay well, and then we get happy.
And Dr. Abbott, how do we breathe well?
I think we should stay well. and to breathe well, don't smoke. Do not smoke.
Great answers. Great show. I want to thank you, Dr. Goldberger, Dr. Sanford Koifman, and Dr. Mike Abbott for coming in. We hope we've been able to help you. Now, it's good to remember you should always be proactive about your own health. Speak to your doctors about your concerns. Go for second or even third opinions. And next week, we're going to discuss women's cancer, rheumatology, and general surgery. Sounds like a great show. So visit our website at netny.net/askthedoctor. Here you can read the tablet weekly column that we have, podcasts. You can email your questions in advance. And remember, participate in that viewer survey. Get out the tablet, go to page 43. Ed Wilkinson wrote a beautiful editorial that you should read that about why you should fill this in. I want to thank Dr. Linda Lapatosa, our quizmaster. And I want to thank you for all these questions. We had a great show tonight, a lot of questions for everyone. Tune in tonight at 10 o'clock, though. Don't miss this, an encore presentation of last week's show. If you couldn't believe your eyes last week, wait till you see this follow-up at 10 o'clock. So I expect to see you watching that. Goodbye, stay healthy, and see you in the tablet.